Hi, I'm joined again by Dr. Catriona Melville, who's one of our board members and is also a gynaecologist. And I've asked her to come on here to talk about the surgical care options after a missed pregnancy loss. And we wanted to do this not as advice. This is not advice to anyone. It's just so people, after they've had their consult, if they haven't taken it in, can come back and listen to roughly what's going to happen. So they can listen to it in their own time and they can prepare themselves. So thank you so much for joining us, Catriona.
Yes, no problem. It's good to have a discussion. I hope it'll be helpful to the listeners.
So we wanted to talk about surgical care after a missed pregnancy loss. How would you describe what surgical care is?
Yeah, so there are various options, Peter, for surgical management, but the actual procedure itself is generally the same. What differs a little bit is the anaesthetic and pain relief options. So I'll maybe start with the procedure itself. What it involves is the person that's doing the procedure will gently open the cervix and then they will remove the pregnancy from the uterus. And that's the procedure complete. And the different options are, traditionally that's been done under a general anaesthetic, so you go into the operating theatre and be asleep. In some other clinics they do twilight sedation or light sedation for that, so that's a second option. But what's actually happening in some states now as well is there's a third option, which is more of an outpatient option. So rather than go to day surgery, and often you don't need to fast either for this, you would have this done with a local anaesthetic injection into the cervix. That does sound really uncomfortable, but actually we do that for a lot of other procedures. Mostly those patients or women would have some additional pain relief. So they would use something like the green whistle, which is Penthrox, you might have heard of that, or they might use something like Entonox, which is the happy gas. So those are the kind of different options, but the actual surgical process is generally the same. And the procedure itself usually only takes about 10 to 15 minutes. There's no cuts made. If everything's straightforward, there's no cuts made on your tummy or anything. It's all done vaginally.
Okay, and one of the things I do want to emphasise, if you do have this done at a hospital, and especially if you have an anaesthetic, you won't be able to leave without someone to escort you home. So that's just generally hospital policy. Even if you don't think that you need someone, it's just something that most hospitals will insist on.
Yeah, absolutely agree, Peter, having the support person. And that's sadly sometimes why, although we give women choice, that the choice actually is determined by things like that. Because after having an anaesthetic, you're quite right, most departments won't let you go home without an escort. The escort doesn't necessarily have to drive, but they have to be an adult, so they could take you home in a taxi. But yeah, you're not allowed to leave by yourself. Whereas I guess that's one of the advantages of having the local anaesthetic option, if it is available, is that you can actually drive yourself home usually if you feel okay.
Yeah, and I suppose should they expect afterwards? So what type of bleeding and the cramping and anything else?
Yeah, so again, there's various different types of wraparound care, I guess, because for some women as well, before the procedure, the doctor will give them some medication to soften the cervix and make the procedure easier. That particularly would happen to you if you maybe hadn't had any bleeding at all with your pregnancy loss, so a complete missed pregnancy loss. So that might give you a little bit of cramp before the procedure. And then afterwards, I would say most people do wake up with a little bit of cramp. I mean, when you have sedation or anaesthetic, part of that usually is quite a strong pain medicine that's injected into your bloodstream, but that will wear off. And yeah, some people will just have that wake up with the strong period cramp. If you think that you've been asleep and you've been completely comfortable, and then you're awake and you're just aware of this cramp in your tummy. Generally, things like hot packs and some more pain relief is given before you go home. But yeah, most people actually manage really well. They don't find that too uncomfortable. In terms of bleeding, it's quite normal to be bleeding afterwards, and it really will depend a bit on how far into your pregnancy you were when you had your pregnancy loss. So some people might just have light bleeding for a few days. For other people, it might go on for 1 to 2 weeks.
And is there any diarrhea or nausea involved?
Not usually with the surgical procedure itself, but if you do have the medication before the operation just to get the cervix ready, then that can have some side effects as well as the cramps. You might get a little bit of diarrhea and nausea.
And you can get nausea from a general anaesthetic as well.
Oh, absolutely. Some people do feel a bit sick. And again, it's always worthwhile, if you've had that experience before, when you go into hospital, speaking, your anaesthetist will come round, that the person that's going to pop you off to sleep, and just say to them, I do get sick with anaesthetics, because quite often there's some additional medication they can give you just to help prevent that or minimise it.
And we've talked about period underwear in the past and how much we really love it, but during this period we think it's a really good idea to use pads, because when you're using period undies it's really hard to measure or estimate how much blood loss you've had.
Yeah, absolutely. And also, it's really important that we minimise any risk of infection after the procedure. So your cervix has been open and we've done a procedure. So we want to keep that area as safe as possible from infection. So we would recommend that you don't use tampons. And again, a pad would be ideal because you can estimate the blood loss. And we don't put anything in the vagina, so no sex, and don't sit in water, so no swimming or baths for at least 7 days or whatever the prescribed time is by your health practitioner. So they may say longer than that. They might say till the bleeding is lighter or stopped. And that will just reduce that very small risk of infection. In terms of the pads, usually the bleeding will get lighter and lighter after the surgical procedure, but it is important that you can monitor what the bleeding's like, particularly for the first 24 hours, so that you would know if you were bleeding too heavily.
And one of the things that you pointed out earlier was that a small amount of blood when it goes into water looks massive. So if you're sitting on the toilet and you look into the toilet and you've passed some blood in the toilet, it is going to be quite confronting.
Yeah, absolutely. You can just imagine that, like a drop of ink into a glass of water looks like a whole blue glass of ink. So it's that kind of concept, and that can be a bit frightening. So, if you are bleeding in the toilet, it's just important to clean yourself up, pop on a clean pad, go and have a lie down, and, just check your pad after maybe 10, 15 minutes just to see exactly how much blood loss there is, because sometimes it's not as much as you're worrying about. Sometimes it is quite heavy, and in that case you would need to seek some urgent medical care.
And is there the same sort of rule of thumb that if you soak through 2 pads in the hour for 2 hours and that continues, you should seek medical help?
Yes, I mean, generally after the surgical treatment for pregnancy loss, your bleeding should be lighter than it would be with the medical treatment. So when you do the medical tablets, that is causing you to pass the pregnancy, whereas when you're having the surgical procedure, the pregnancy is removed when you're asleep in theatre. So the bleeding should be lighter, and definitely if you are soaking through pads, particularly 2 pads an hour for over 2 hours, I would definitely be seeking medical advice.
And so other reasons to seek medical advice is if the pain hasn't settled and it's getting worse, you develop fever, chills, or feel faint, if you notice any unpleasant smelling discharge, or if your bleeding continues beyond 2 weeks without easing.
Yeah, absolutely. All those things. And, most services will give you definitely contact numbers for within office hours, and also what to do to seek urgent care. And I think sometimes as women, we're reluctant to, cause a bother or trouble people. I'm saying that in quote marks. You can't see me saying that, but essentially it's important that if you feel uneasy, trust your own intuition. If you think something's not right, if you think the pain's more than you thought it would be, or you think your bleeding's heavier than it should be, it's really important that you reach out and get some advice. People would far rather you asked for help and advice and they give you reassurance than you became unwell and didn't seek advice.
The other thing is it's ideal that you don't work, but everyone has different circumstances. You may have 2 children at home, you may have other issues that you can't get around, but we do recommend, especially after a general anaesthetic, that you rest.
Yeah, absolutely. I mean, you certainly, and they will give you this written advice. Not only can you not drive yourself home from hospital, you also aren't able to sign any legal documents, or you shouldn't operate machinery. So, women are very busy, but they should not be coming home from this procedure and then trying to cook dinner for the family. It's time. This is a time in your life and a moment that you have to prioritize looking after yourself. However difficult that might seem, and I know people have sometimes got very challenging circumstances, but it's, one day certainly is the day that you should be resting. Obviously, some people still do feel quite wiped out in the days afterwards, and ideally, if you can take a bit of time off work and rest, and if you have got family or friends that you can reach out to, it's really important that you get some support, even just with those practical things. No cooking, no cooking dinner.
Make sure that you have some water near you and some snacks, because, then you've got that backup that you can rest.
Yeah, absolutely. And obviously, you will have to fast before the procedure if you're having an anaesthetic or a sedation. So you'll probably wake up and you'll be quite hungry. And, any pregnancy symptoms like nausea will usually have gone by then as well. So, you might be quite hungry. You might not have been eating well in the days before the procedure because you've been feeling sick, or you've just been, very emotionally challenged. So yeah, definitely afterwards they will give you some food usually before you go home. They like to check that you can eat and that you're not feeling too unwell. But yeah, have some food at home as well ready so that you don't have to worry about going out to the shops.
And is there any follow-up care for this?
So generally after the surgical procedure, because at the time the doctor knows that the procedure's complete, there often isn't a routine going back to hospital or anything like that. Some people will have a follow-up arranged with their GP, and if their GP has been involved with their care, they quite often do like to go back and just have a check-up and see that everything's okay. And as I mentioned earlier, you should have some contact numbers so that you know who to reach out to if you think things aren't quite right.
Okay, well, thank you so much. I just think it's good to have that as a backup so women can come back to this podcast and just go over what may be happening or what may did happen.
Yes, I agree.
Okay, thanks so much, Catriona.
Thank you.